This is the third in a series of West Michigan Policy Forum discussions on how to bring Michigan safely back to work. Today, our main focus is on health and the healthcare sector, including our West Michigan hospital leaders. We have several CEOs from multiple organizations who have joined us, as well as executives from Grand Rapids, Muskegon, West Coast, and Lakeshore Chambers, as well as the Right Place, Talent 2025, and we also have a number of media organizations around the state listening in. I want to welcome Doug DeVos, co-chairman of the Amway Corporation and the past chairman of the West Michigan Policy Forum, who has agreed to moderate today's discussion. And a reminder, all guests, stay on mute, but turn off mute when you want to jump in on the conversation. Good morning, Doug.
Good morning, Aaron, and welcome everybody. Great to see you. I don't know how you have things set up on your Zoom, but I have all the squares there. It looks like Hollywood Squares. So if anybody remembers Hollywood Squares, I feel like Peter Marshall a little bit, moderating all this, but we are going to have a great time together. Thank you for joining us. You know, it's really important to share ideas, to share best practices, to share what we're learning. We've been doing that, as Aaron said, in other calls with amongst business leaders. But today we are thrilled to have some hospital leaders, health leaders with us to expand our learning on this particular situation. So this is not a simple thing. It's not something we're necessarily used to, but we're going to have to get used to. This is something that's going to be here for a while. It's not just going to go away. It's going to change the marketplace. It's going to change the workplace, and we're going to have to be aware of that. And in this time where we're all making sacrifices and changes, certainly there's a huge chunk of the population who's making a tremendous sacrifice because their livelihoods are at stake, their businesses are at stake. And so this is highly valuable, highly important to everybody across our state, across our country, and indeed around the world. And so maybe as we frame this for all of you joining just a little bit briefly on West Michigan Policy Forum, you know, the first element that we've struggled with is the essential versus non-essential designation. We believe every business, all work is essential, all employees, people are essential, and that impacts business and it impacts health. And so that's why it's so important for our healthcare professionals to be here with us. But the idea is to go beyond essential to talk about safely. How do we operate in this new environment? And there's different plans. We have the Michigan Economic Recovery Council, we have the House plan, we have the Senate plan. And maybe as we bring them together, there's a few things that at the West Michigan Policy Forum, we see as themes coming out. One is a phased approach. This is step by step. We're not just going to go back to normal or the way it was, I should say. We're going forward. So whether that's step by sector or geography or in timing and that sort of a phase. We are going to rely on our medical experts. Absolutely. We can't just jump into something and make mistakes and cost thousands of lives or to take a step backwards from the work that we've already accomplished. We want one plan. Now, there may be different parts in that phased approach, but one plan. We really need to coalesce around something where we can all get behind it and move forward. We know that on that plan, we're going to have to rely on data, on science, on facts, so that we can have objective steps that go forward. What are the conditions? What are the facts? And how do we put this all in perspective? So we're grateful for our health professionals that are joining us here. And we want to kind of start in with you. So I'm going to start to focus on some of the health professionals, and I'll kind of walk through. I think many of you know who's on the call, so we'll catch that as well as we go. But so for our health leaders, as we start here, you know, a few things to think about. We're starting to see states shift. We're starting to sense some level of stabilization, if you will, with the progress of this disease and the challenges it presents. So how do we balance that health risk and that workplace risk? So let me bring a few questions, and then we'll start down. I'm going to start with Dr. Hahn from Metro Health. So I'll give you a few questions, and then the rest can kind of think about it too. So how are you dealing with patients that are non-COVID-19 related? There's heart health, there's cancer health, there's traditional health issues. How are you dealing with that? And what's happened since everything's kind of stopped in mid-March? And what are your plans to start staging a re-entry or a recovery for your employees, for your physicians, and for your customers. And you're right in the middle of it, so you all are going to know. And then can you give us some best practices? What have you been observing? What have you been putting into practice yourself so that in the business community, if we can follow those things, we can be safe too, because you are right in one of the most challenging environments. And so those things I think will be very helpful. If you can talk about some of those things for us. So Dr. Hahn from Metro Health, let's start with you and then we'll start going around. So Peter?
Thank you. Thank you. It's sort of amazing how all the subjects I used to avoid in college come back to haunt me in terms of statistics and immunology. But, I think a few things. We've yet to see a true surge, or what we call internally a wave in West Michigan yet. I think the modeling, which we looked at different modeling with St. Mary's, with Spectrum, as well as with Michigan Medicine. And the modeling tends to suggest that we probably are going to see an uptick of cases here in a few weeks, maybe the end of May. It's just a matter of how big and how wide that wave is, whether it's a Pacific or a like Michigan wave. I think we've got a window of opportunity for sure, where we need to really focus on those patients who have avoided care for very good reasons in most cases. I think ways to do it is, thinking back to even many years ago with HIV, there are going to be parts of the hospital which will truly be COVID wards, if you will, and then other parts of the hospital that will be non-COVID wards. And I think one thing we're strongly thinking through is, for example, with patients who are coming in for surgery, and truly as we get to a point, and I think we're getting to a point soon where we can do true elective cases like hips, like bariatric. But when we truly do those, we want to test those patients ahead of time. And it's not to get too much into the details, but it's important to realize the difference between qualitative PCR and true real-time PCR. Qualitative PCR is pretty quick, but that result stays positive sometimes 2 to 3 weeks because it measures both live and dead virus. Whereas real-time quantitative PCR is much more accurate in many ways. And so testing patients as they come in for surgery and getting to a point where we test all patients that are coming into the hospital. I think a flip side too with the COVID and non-COVID wards is that, we, like our organizations around the state and the country, when a patient comes to the ED, folks with respiratory symptoms are automatically taken to a different area. So it's really, a lot of this is reality. A lot of this is also perception for patients. And so we've got to do our best to address both. And it's testing, I think, is a key part of it. It's different areas of the hospital is a key part of it. I hope I didn't go too long, but
no, that's great. I was going to ask one question. PCR, help me out on some of the terminology.
Sure. Polymerase chain reaction. And so the testing that we're all hearing about in terms of the nasopharyngeal swabs is PCR. And so you're really looking, it's a pretty complicated test with a lot of cooling, heating, sophisticated machines. I think we're going to get to a point though, and I think that's what's great about this country and this region is just innovation. And so potentially down the line, we'll have true antigen tests that are much easier to perform and could be performed at a much wider level, like the influenza swab. But I think there's a lot of developments, probably even within the next 1 to 2 months, that are coming down the.
Great. Thanks, Dr. Hahn. Thank you so much. Appreciate it. Dr. Kim from Mercy Health, we'll ask you kind of if you could touch base on the same kind of topics, how you're looking at these things.
Certainly. So on the 3 topics, first, I would want business leaders in our community to know that, we've been taking care of non-COVID patients from the start. And what we've done is we've postponed a lot of things to make sure that we had the capacity and the personal protective equipment to be able to manage the projected surge of patients. But we've always been taking care of COVID-19 patients. And I think for all the health systems in our community, we've always had more non-COVID-19 patients and COVID-19 confirmed patients from the start. And so as we think about bringing things back, it's really, partnering with patients, our physicians and other providers and our teams to understand, who has the kind of time-sensitive needs that really we don't need to wait on anymore. Because we know that the social distancing has really had a big impact. And so we're comfortable that we can handle the surge as it occurs. And so it's really more a bringing back than, starting from the beginning. And in fact, it's almost, the pendulum has almost swung too far, where it would be great to be able to send the message to everyone in the community that, it's both safe and it's smart to get the medical care that you need. That one of the advantages of being in West Michigan is we have so much world-class healthcare, and that all of us are, we're ready to serve. And so that's really the big message, I would say. In terms of advice and what that means for other businesses in the community as they begin to come online, I think I would suggest 3 or 4 things. And the first one is around, as we do it, remember that the physical distancing that's had such a positive impact, we need to have policies and procedures and thought that continue to put that at the center of what we do. And some of that includes really trying to figure out what needs to occur in person between your people and your customers, and what can occur virtually. So for us, virtual visits have really been huge. And so, that's something that I would suggest that other businesses need to look at. Number 2. Number 3, just have a sense that it's going to be there are these general principles that make a lot of sense. But in terms of how you apply it, to really understand that local matters, because, for Mercy Health St. Mary's, being a part of Trinity Health, the national health system, means that there are these principles we believe in around safety and quality care that applies everywhere. But because the COVID-19 incidence rates are so different across the country and even within our state, the way we implement it really, really differs. In fact, it really differs even within St. Mary's, because we have our colleagues who are really patient-facing, do different things than ones who are not. And so, as businesses bring their work back up, we would suggest that you should take that into account. And then the final one is just to be very comfortable about understanding this is an iterative process, that you're going to try some things, you're going to see how it affects your customers and your people, and then you're going to make step changes to do a better and better job of doing that. We, for over a month now, we've been having reduced entry points, and we have kind of restrictions to make sure that our colleagues who are sick are not coming in. And the joke is, it seems like every other day we're doing something different at the entry point, and that's because the things that we're learning are changing, and the situation is changing. And so the fourth thing that I would suggest for our fellow business leaders is to take into account that kind of experimental and iterative approach. Wow.
Yeah, excellent. Thank you so much. And I think you hit on the messaging, because it's hard, it's complicated, it's new, the messaging coming through. And what I'm hearing from you is that you're moving forward cautiously, differently, aware of our surroundings, but you're taking, the principles broadly, but you're applying them locally, right?
That's right.
Yeah. Great. Thank you for that. Tina Friestecker from Spectrum. Tina, can you give us your perspective on these topics as well?
Thank you so much. So it's good to talk to all of you. And as you all know, our business is time sensitive. It matters when we see and when we treat people, because we want to make sure that they have the very best outcomes as we serve them. As Young and Peter both said, we have continued to take care of our community throughout the COVID-19 pandemic. And what they both iterated is the same for Spectrum Health. We have a whole lot more patients that are non-COVID positive than we do that are COVID positive. Just to give you a statistic, today on my dashboard, we have around 650 people in West Michigan Hospital, and about 50 of them are COVID positive. So again, the vast majority of people that we are caring for are do not have COVID. We do continue to screen people to make sure we understand what their symptoms are, and we are applying all of the principles that Young and Peter mentioned to make sure we're taking care of our patients in the most effective way. Those include hand hygiene, the appropriate PPE, depending on what patients we're taking care of. Every person that comes into one of our facilities, whether it's an employee or a patient, receives a mask and is asked to use hand sanitizer. We're screening our employees every day to see how well healthy they are, and if they do need to go for testing, we send them immediately to testing. Social distancing or the physical distancing is important. So we've redone our waiting rooms. We've made sure our entrances are clean and clear, and the processes are in place as people enter into those facilities. But again, the vast majority of the people that we're caring for do not have COVID. A couple other statistics I thought I'd share with you. Over the past 6 weeks, we've screened 50,000 people for our screenings. We've done 10,000 tests, of which a little less than 1,000 have come back positive as of last Friday. And so that tells us where we are in the community. And we're starting to expand the testing. We can now do over 1,000 tests a day based on some of the limitations with the reagents and testing kits. We have capacity to do more. We just need to get more of that equipment. But as we do that, we're testing not only the symptomatic, but then those with mild symptoms. And we're also testing those that come in for surgery or endoscopy procedures to understand how best we can care for them and to protect our team members as best as possible. We are paying special attention to the potential of delay of care. It's important that our community knows that we are a safe place. We have stringent cleaning requirements. We understand the PPE that's required to take care of people. And so we are a safe place. When we call patients to say, we think you should schedule something, we recommend various ways to do so, but we also recommend that they actually do receive the treatment because we want to ensure that we're not harming our patients even more by delay of care. For cancer treatment, as you brought that up, we have not seen a decline in cancer treatment, which is fantastic, because we want to make sure that people get the care that they need, especially when they're battling cancer right now. And there are a number of other diseases that we're very focused on, strokes and heart attacks to name two, that we want to make sure people understand that, again, our organizations, as well as the others on this call, are safe places to go. We can help you get better and treat your disease.
Well, all three of you, thank you, for the insight. A couple messages. One of the things is getting the message out, which you all are effectively doing. Because one of my questions is, what should we know that we don't know? And one of the striking things for me is how much healthcare you're providing for non-COVID patients in the scope of things. And two, while you're all essential, you are all operating in a safe environment. You're in operating very, very effectively. I think that's important for the rest of the participants on the call to know as well. Maybe quickly, we do have more to do, but maybe quickly for either one of you, testing, let me ask the question in this way. One is to test an individual. The other, we've seen some testing done just population to get our idea of the prevalence of the disease. Is that potentially another application that could be used so we can get a better understanding that rather than just testing every individual, that you would test to see potentially how far the disease had spread so we'd have a better understanding of the lethality of it or something else?
All of us were on a call last Friday to talk exactly about this, where we're going to be working with the county to talk about how we test asymptomatic patients. Specifically, we can look at the population that's coming in for surgeries or endoscopies that don't have symptoms, separate them from those that do have symptoms, and get an understanding of what's going on in our community. That'd be the first step that we're taking, and then we have other ideas about how to take it farther from there. We're also working together to look at information based on demographic data because we want to better understand the health disparities. And so we'll be pooling that information to do some research on to make sure that we're improving healthcare going forward and ensuring that we have the outcomes that we can all be proud of.
Great. Dr. Hahn, Dr. Kim, anything to add?
Okay,
Yes, go ahead, Peter.
despite what everybody's been reading and hearing about antibody testing. And I would say that there was a really elegant article that UCSF put out over the weekend that really talked through it well. Despite all the pluses and minuses and some of the unknowns that we have, I think antibody testing will be very important for that very reason. Really look at prevalence to get us prepared for, the late fall and winter, and really know the prevalence here. Because if you look at studies that have been done in LA or Santa Clara or even New York, much more people have been exposed to COVID than we can possibly know right now with the PCR testing.
And I think I would add to that is that first, we already know a fair amount from the testing that's already been done. I mean, the positivity rate for the state is like 27%, but for region 6, which is the region where we are, it's about 10%. And because each one of the health systems have been taking a little bit of a different approach on testing, that gives us a lens on it. So for instance, for weeks, we've been testing all of our inpatients, even the asymptomatic ones, to get a sense for it, to make sure that we're able to appropriately cohort. And I think for us as Mercy Health St. Mary's, we would like to take the next step and have the county and the health systems really partner to test key populations within our broader community. So for instance, with the county and Military Health, we've started to test the homeless persons in the Hartside neighborhood. There are other populations, either ones who we think are especially vulnerable or ones that just tend to have more contact with other folks that we think there's value in testing to understand what the prevalence is. So for example, we're going to start offering to some of our colleagues, asymptomatic colleagues, that they can get tests if they want. I think similarly that first responders should be tested. African-American persons in the community, Hispanics and Latinos, they're just certain populations that from a public health standpoint, it just makes sense for us as a community to come together to test. And the reason that I think we need to do it together is because it's kind of a sizable number. I mean, whether you believe in the 20% of the population number from the Harvard folks or the 1% number from the other folks or something in between, it's just too large of a number for any one health system to do alone. The other part of it is that we need to get, funding. I think there's been a lot that's been discussed about needing more reagents and needing more swabs. But, it looks like for us, it costs about $100 to do a test. And the reimbursement, like so much of other COVID-19 related care, doesn't really cover it. And so as a community, it would be great to come together to identify these subpopulations and together figure out how to do the testing, how to do the funding for it, and how to use that information.
Great. Thank you all. Excellent insights. Very helpful for all of us across the board. I'm going to keep moving a little bit. Dr. Tammy Bourne's on the call. And Tammy, you operate in a little bit more of a clinical setting, much more personal. Maybe talk a little bit for you about how your staff is getting ready to continue their work at this time, how you're applying some safety standards in your situation.
And maybe I can speak from the perspective of other family practice offices in the area. It's definitely been a challenge with testing everyone. We've had to change employees. We are running about half staff right now. We're starting to call some people back. We have been doing some IVs and treating patients that are just basically in pain. Other than that, we've switched over to telehealth, and that's not my favorite way to practice medicine. I love to see my patients and help them feel better, but I think it's going to be a new reality. I think we are going to have to learn how to live with this, and it's going to change the world, and it's going to change how we practice medicine in an office too. We have had our whole office treated. We have our cleaning staff coming in, doing extra bleachings as much as we can, at least once a week that we've had that. So really trying to keep patients and staff as protected as possible. Now, I think looking forward, I'm really anxious to get started doing some studies on nutrition and how we can figure out what's going to be the best way to keep the West Michigan healthy. We have been working with a couple of other companies looking at how we can just look at it, not always being so reactive, but also being proactive and trying to just to keep healthy. What kind of better nutrition can we recommend? What kind of nutrients can we recommend? I think there's a lot of really good studies out there that are showing, and even other countries are doing, that can help us move forward and stay healthy. We would rather be in the group that doesn't have symptoms than the group that is dying. So how can we make that transition for many of the people in West Michigan? I'm really anxious to get started on doing those studies.
Great. Thanks, Tammy. You're spot on. The whole idea of comorbidity and being healthy to begin with is one of the best defenses that there is. Kent Riddle, you're here. Let me turn to you from Mary Friedbad. Your perspective. We heard a lot about treating non-COVID patients. You're down the path that way, I think. Can you fill us in a little on your perspective of how you're, maybe looking at that situation?
Yeah, you bet, Doug. Like the other hospitals, we've kept about 70% of our services going throughout this process. We closed about 30% of them that we just deemed non-essential. As Tina said, we're seeing that the delay of care is actually disadvantageous for patients. So we're looking to reopen some of those services. Many of them have been flipped to virtual, but there are a lot of cases where we've got to have a patient in front of a caregiver. So what we're doing is following the CDC recommendations. I believe that if businesses do the same in most sectors, wearing masks, physical distancing, we are screening all people who come in and out of the facility, doing a number of tests, and then closure of high density areas. There are these CDC recommendations that really can keep people safe. As we've kept these services going, we have not yet uncovered any situations where it has been unsafe. So I do believe that we're reopening now, and I believe that other businesses can as well and do it safely if we follow recommendations. I think the other thought I would have is that we have to continue to enhance the public health messaging. And I think that has to be constant and redundant and reminding people of all these recommendations. Yeah, and then I guess the final thing, Doug, is, we have segregated our COVID patients from non-COVID patients completely. And that seems to be working very well too.
Well, yeah, Kent and Tammy and everybody, thank you. In a very similar fashion, the things you're doing, many cases sounds like some of our previous calls, what businesses are doing. So the business side of medical operations seems to be very, very similar. And so let me transition. Thank you all for your comments. We'll get back to you at the end of the call as well. But I want to transition to some of the business leaders on the call now. To talk about some of the things you're doing. So a couple of questions or a couple of topics for you to talk about. What are you doing where you have, based on what the hospitals are doing or our past discussions, what are you doing in some of those closed manufacturing sites? And what percentage of your workforce are you operating with at this point in time? And how do you see that developing? And again, some of our businesses have been deemed essential, even though we're not thrilled about that term. And others are still struggling. But tell you what, Ron Janisch, if you're on the call from Perigo, maybe you can talk a little bit.
We obviously have been, we're one of the companies in the area that have been deemed as one of the essential employers in the area. As everybody probably knows, we produce over-the-counter and RX pharmaceuticals in most of our facilities. And so it's been very important that we keep our facilities open and running as much as possible. Back in the kind of mid-March, we obviously sent all of the folks that were essential but could do their jobs from home. We sent them home to do what they do, but they could do it remotely. We still have about 3,000 people coming into our factories here in Southwest Michigan, for example, between Allegan and Holland. We are on average seeing, I would say, and it varies day to day, but roughly 12 to 15% absenteeism in our workforce, but generally speaking, we're still seeing a fairly large number of folks coming into our facility. We've taken a lot of precautions going back again to the first half of March to try and ensure first and foremost that our essential workers coming into the plant are first and foremost safe. That's our primary goal, obviously. We've had only one confirmed case in our facility here in Allegan, for example, which is our largest population, and so we're being very robust in our screening. We've taken a lot of actions within our facilities as well to try and ensure that our employees can actually social distance. So we've staggered our starting shifts. We've reconfigured all the break rooms where we can't actually ensure adequate social distancing. We've put up engineering solutions in place, plexiglass guards in between employees, whatever we can do in order to ensure that our employees continue to be safe when they're coming into our facilities. But all in all, even though we've seen a slight uptick in absenteeism, we still have a very engaged workforce, and they continue to come in every day. We learn something new all the time. We enhance and increase the robustness of our screening process. Our screening process, first and foremost, is most critical, frankly, for our teams, frankly, and it's been a great help for us so far. We're now in that process of looking at, knowing that some point in time down the road, we are going to have to start having our remote essential employees coming back to work in some way, shape, and form. And so we're now starting to plan what does that return to workplace look like for our remote employees today. And frankly, we're leveraging a lot of the stuff that we have done for our production personnel to see most of that is going to be very applicable to what we ultimately do when we bring our office staff back as well in the future.
Well, great. With 3,000 people there, that's a huge population, and to only have one case. Did I hear that correctly?
Yes, you did.
Great. Can you, Ron, you're also head of supply chain. Can you talk a little bit about what you're seeing maybe in your suppliers, because you can't operate without your supply chain operating, and as they're deemed to be operating as well. Are you seeing them apply these same sorts of standards that you're doing, and are you seeing similar sorts of safety measures maybe from them?
Yeah, absolutely. We have a very global supply chain. We also have a number of key partners here in the Southwest Michigan area. When you think about the likes of Praxis and Unipack, we've been very open with our suppliers, not only in Southwest Michigan, but across the globe, and sharing some of the best practices that we're using in our facilities that we found have been working. We've shared that with others. They've been very open, receptive. For the vast majority of our supply chain as well, we have a few hiccups, surprisingly, with some of our third-party CMOs in Europe, for example. We all know where Europe was. They were several weeks ahead of us. But generally speaking, from a U.S. perspective, our supply base is still operating pretty efficiently at this point.
Great. Okay, great. Good to hear that. Thank you. John Kennedy from AutoCam Medical. I know you're on the call, and you've got some perspective. You've been operating as well. Love to hear from you on these sorts of things, how you're operating there, and your workforce, and how you see things going in the next few weeks.
Yeah, so we have been operating, since obviously the entire time of the shutdown, and we saw it very clearly as safety is a big thing in our organization, anyways. And this was never a choice in our mind. We had to make sure it wasn't a choice about life and death. We had to make sure it was a choice of how do we ensure the safety of our employees while we're working. And I would agree with something I think was said by Dr. Hahn. This has been an iterative process. We've learned as we've gone through this that I think the workforce, we've gotten much safer. And some of it is the walks that I quite frankly do as the owner and leader of the plant, just through the facility. And quite frankly, you see practices going on, like, we pull all the lunchroom tables out, and so there's only one chair at the lunchroom tables. And then, it's our human nature to, obviously to get together, and so they push the tables back together. And I have to go to the lunchroom and and tell them to pull them apart. We can't do that, because we assume that somebody in the plant has COVID every day. And so if that person is allowed to spread it to the rest of the workforce, it's not safe for our workforce. So one of the things that, just summarizing a few things that we've done, and we have kind of a symptom survey and temperature check of every employee, and we give them a mask, a surgical mask every day. We keep people out without symptoms. I think that's probably the best thing that we've done. It's not uncommon for people to come to work with a cold or whatever. And what we've said is, look, that's just not acceptable, because the cold could be COVID, and then you're going to spread it to the rest of the plant. And for a long time, we had people out with symptoms and they weren't able to get tested. And so it's good news that they can now get tested for those symptoms, which will make it easier for us to bring them back sooner once those symptoms have cleared. I think the biggest thing is the social distancing, and this is a new reality and a new way we're going to have to work and, quite frankly, live. Is that we have to just understand that we have to keep adequate distance between our employees and our workstations and et cetera. And we've moved stuff around in the plant in order to be able to accommodate that. We have very strong policy around plant hygiene in terms of, we have people that literally are working full time, just cleaning all of the work surfaces that hands touch, during the day, and a couple times a shift. And then we have masks. You are not required to wear a mask today at your workstation, because most of our employees are operating with, in 100 square feet where there's nobody else around. But they are required to have the mask with them at all times, and anytime they're walking around the facility, they have to wear the mask. I really feel like we've done a good job. One of the things, we just made a change actually this week. We had a number of people that we viewed as vulnerable. They had another one of the, let's say, comorbidities, and unless you actually, are having some type of treatment, or actually we welcomed those people back today. Because we were having absenteeism and having trouble meeting schedules of 17 to 23% once you take people out with symptoms, and also people that were quote unquote vulnerable to the disease. And we now feel that our workforce is safer, certainly, than any attempt to go pick up essentials at the grocery store. And so that's the way we focused on the plant, in order to make sure that this truly is a safe experience, because we're going to have to do this for a long time. COVID is not going away, until we get a vaccine. So we all have to figure out, how do we engage in society and work, safely.
Yeah, great. Thank you. Thanks, John. Thanks, Ron. You talked, John, about the workplace being safer than maybe some of the other, going to the grocery store. I also heard comments from Meyer in particular that their rates were significantly lower than the general population around them. Are you finding that as well, that you are able to keep your workplace safer maybe than the general population around you?
So we have 500 employees in the 3 plants. We have had one COVID positive who did not come into work. They were there one day, and then the next day they called in and said they had some symptoms. So we kept them out of the workforce, and paid them to stay home. And then they tested 7 or 8 days later with COVID positive. Now, we had cleaned the work area up where they worked, and fortunately, nobody else in the organization ever got in that plant got COVID. And we've had no other positive tests in any of their plants. And we are going to try testing our employees, hopefully this week, with a private lab.
Great.
So
great. Thanks, John. Ron, anything to add?
Yeah, I would say generally speaking, I think that we believe that our facilities right now probably are safer than the broader general public, just because of all the various actions that we've taken across the board, including the screening process that we've been discussing. I would say, and what we're experiencing here in Southwest Michigan is not necessarily, what we've experienced everywhere. I will readily admit we have a facility in the Bronx, in New York, that's one of our creams and ointments facility, and we all know what's going on in New York and what they are seeing, particularly in the Bronx, and even with what's going on where you've got really widespread community transmission in that area, we've employed all the same screening processes, all of the actions inside the facility, try and keep our employees safe, up to and including, we've done a 5S COVID-19 social distancing marking of the entire facility. So there are 6-foot marks on the floor everywhere throughout the plant so that people know how far apart they need to be standing from one another when they're operating the packaging lines in manufacturing, whatever the case may be. And as a result, I think even though we have a much higher level, frankly, of confirmed positives in New York, I think we are lower than what you would see in the broader New York metropolitan area for the most part. So I think generally speaking, the actions we're taking across the network are making our places much safer for our employees, which is the end goal and ultimately for Perrigo, is first and foremost protect our people.
Great. Thank you for that, those observations. And again, your observation of many companies operating in different locations, like I think Dr. Kim said earlier, then it's a different solution. Let's transition to the marketplace a little bit more, some of the things that are happening. We have Jeff Conley and Mark Eastberg with us here that can kind of give us a little more insight from that perspective. Mark or Jeff, let me start with you. We heard about some telemedicine, things of that nature, the impact maybe that technology is happening. What data are you seeing from your perspective that you can share with us about employers and how they're dealing with health, this health situation, or even some employee populations? What are the things that are coming out that we should know, and how are we using technology, and maybe how you see that changing healthcare for the future?
Yeah, thanks, Doug. Let me start with I would say the data, which is important. I think first and foremost, we gather our data as the claims come in, so there's inherently a lag. Probably a little more so with COVID because we waived copay and we waived prior auth for the right reasons. That being said, the data will be available on an employer-specific basis, not just which of your employees have or had the COVID, but what were the treatment scenarios, what was the cost, obviously, and it's important from a holistic view. And I know Mark's also on, but it's not just the medical treatment, but it's also the mental health, substance abuse that could and would be attached to that. Secondly, and I think this is really important, we announced last week with 26 hospitals around the state, with Michigan Medicine, University of Michigan, to build a patient registry. So this is not something that we're going to see in 90 days, but it's really important from a statewide, as we understand what this COVID is, and where it's distinguished, not just on a statewide basis, but a regional basis. And that's the importance here. So obviously it's affecting Detroit much greater than it is other parts of the state. We think that's going to be one of the largest in the nation. And it'll be used when and if we see a second wave on this. We'll know a lot more in terms of how to treat it and what to do from a business perspective, depending on where your business is located. 3, telehealth. And I think this is probably one of the positives that will come out of this. Historically, we would see some hospitals 500 to 600 a week. We've seen several hospitals that are now seeing 5,000 to 7,000 telehealth visits a week. And I know I can attest to that from talking to some of our larger employers. Our vendor, Amwell, their telehealth visits in April alone were up over 150%. So the good news is you're getting treatment, and not just medical treatment, but you can get mental health and substance abuse as well. So with that, I will turn it back over to you.
Great. Well, thanks for that insight, Jeff. I should have mentioned Jeff's with Blue Cross Blue Shield. I'm sure many of you know Jeff and are aware of that. So his perspective on what they're seeing in the from that side is really, really important for us all. So thanks, Jeff, for that. Now, Mark Eastberg from Pine Rest. Jeff started to allude to some of the other things that are happening, as we heard from the other hospital leaders, that there's more than just than COVID-related health issues, but boy, there's a range of emotional and personal issues that are going on too. Can you, with the, sometimes the medicine has a side effect, right? And so help us understand some of the things maybe that you're seeing from your perspective.
Sure, thanks, Doug. First of all, a little background. We did a study that will be released at noon today on what are the likely mental health outcomes for Michigan as a result of the COVID-19 crisis. And that will be available on our website at noon today. What we did was looked at what were the implications of mental health on the SARS back in 2003, and even some new studies coming out of China. And what we found is somewhat alarming. We can expect a high increase of mental health issues coming to Michigan. Many of the factors that are predictive of suicide are currently, we are present right now in Michigan: financial stress, isolation, insomnia, lack of community gatekeepers. So, and also the fact that many people, many of your employees who are going to be coming back to work have really experienced some life-altering traumatic events. So as you think about preparing as a CEO, caring for your employees, an important thing I would suggest is right now, if you have an employee assistance program, now is the time to connect with the leaders of that program. Develop a communication strategy for how you're going to remind your employees that benefit is there, you've been paying for it, take advantage of it. Many EAPs have services beyond just counseling. They have opportunities to do coaching for managers. Take advantage of those. Brush up on what your mental health benefits are as well, to remind employees that they're going to, that those are there for them, available. We expect that you're going to see that in the people that are coming to work if history repeats itself. What we have found, interestingly, to support Jeff's point, is a high degree of acceptance of teletherapy and telepsychiatry. We went from 100 visits a week to we're doing 6,000 visits a week right now. And so, one of the messages that I would want to communicate on behalf of the mental health community, not just Pine Rest, is that many mental health providers have made that transition to telehealth. We're open for business now. We're ready to care. And so it's just a matter of making sure your employees know that service is available to you.
Wow, really, really important. And I thank you both, Jeff and Mark. Mark, maybe just elaborate a little bit more. When we start to re-engage again, we start seeing people, what are some of the things we should be thinking about with our friends, our colleagues, as we not only get back into the workplace, but just kind of get back into some level of social activity, even if we're distanced?
Right. Well, some of the messages that have been communicated already, your CEOs are doing a great job just letting your employees know that your focus is on their safety and that you're open for business. So just being present, communicating, I'd say as CEOs, as leaders, to be communicating that as directly as you can with your employees, your management team, that you're looking out for their best interest. And to ask the question behind the question. Everybody has their COVID-19 story. How are you adjusting? What your life has been like, but to go a little bit deeper, well, how are you doing personally? How are you caring for yourself? What are you doing to care for yourself? Just having that included, be part of the conversation is really important right now.
Wow, really, really good. We can't forget the impact that is taking on individuals in different ways. We all respond and react to things differently, and there's a lot of tough stuff going on. A lot of the messaging was very serious. It was really meant to drive a response, and it did. Unfortunately, sometimes received as fear, and that has a lot of different implications. Thanks for helping us open up and be aware of that perspective. So let me go as we're kind of bringing it together here. We'll wrap up with going back to where we started with a lot of our hospital leaders and health leaders, and that concept. One of the things that Dr. Kim did talk about, I think the right phrase, as he said, was consistent principles locally applied. As we think about how we do these things, we're hearing things about how technology is having an impact, and certainly it's having an impact in telehealth, but it has an impact in businesses. And it's having an impact in all sorts of education and other areas of how we use technology where we would normally have done it person to person, especially in some travel and entertainment spaces. So let me go back to, and I'll start with Dr. Hahn again here as we go back. Help us, and as we kind of wrap this tightly here, help us get your perspective of what we would see here, or what you would think we should expect, or we should be thinking about in the next week or two as we start finding our way going forward. Certainly what you're doing, but give us a little perspective on where we would be thinking from a business community, not only as business leaders, but as just members of our community as well, with our friends and neighbors.
One of the ways that I think about it is maybe not the next week or two, but over the next maybe 2 to 3 months, is sort of looking at Australia and New Zealand in terms of, I think, the way that they, it's been sort of interesting to see the number of patients there, the mortality there or lack thereof, and then as they go into their winter, I think will be very learning. I also think there are models out there like Sweden where I think, this staggered approach to opening up, I think there is certainly the need for business to open up safely. And I think one of the key things for us is that what the modeling shows is that we likely do very much have the capacity in West Michigan to handle what's coming in terms of hospital capacity. I think that's important, and I think that's what really should reflect how we look at the next few weeks.
Great. Thank you, Peter. Thank you very much. Dr. Kim, I'll turn it over to you.
I'd say a couple things. The first is what we're going to see in the weeks to come will definitely depend on the decisions that we as business leaders make. And as a part of that, the numbers of positive cases in West Michigan are going to rise just because the testing is going to continue to increase. And so we really need to look beyond those numbers. And so the third thing is that means it's going to be important that all of us stay very well connected so we can share what we've been doing, what things that we're seeing, and what we think that means. We just need to stay in contact so that we can, get the meaning behind the numbers, especially, again, as the number of confirmed cases goes up.
Yeah, really important. That's why this has been so helpful to help us get a better perspective on what the facts, what the numbers mean. Tammy Bourne, I'll pop to you.
Yes, a couple of things. It is difficult to bring these patients back, our employees back when they also have an underlying fear of exposure. So any other ideas, maybe Mark, you could help me with that. But I think making sure we have enough PPE coming in, because we're going to have to be using these masks for a long time. We are trying to take a lead from the hospitals here in town, so thank you for your leadership. We're trying to employ the same kind of protections for our employees and our patients, but we have to realize patients need help. I have people calling every day. They're wanting to get back in. They need their treatment. So I thank you for your advice and your guidance here, but it is hard to move forward. I'll take anyone's advice that I can for getting our employees back.
Great. Tina Friesecker, I want to ask you to kind of do it, then Kent will wrap us up at the end. Tina?
Thank you. First, I just want to say we are so appreciative and grateful for our community members that have helped us get the PPE to where we need it, for all of you that have helped contribute to our frontline workers. It just, the applause, the notes, the food, it's just so appreciative of everybody that when they've received it. I also want to say that we're embracing this new reality just like everybody else is. The way we deliver care will be different, just like the way we do business will be different. And I'm so proud of our team members and community who have stepped up with tremendous heart, with expertise, with innovation, stamina, to really move us into this next new reality that we have here. Our goal is to make sure we continue to serve our community, to improve health, inspire hope, and save lives. And my view over the next few months is really not about the what, but it's the how. How do we interact with each other? How do we support each other? Back to what Mark said about mental health and the whole focus on health, whether it's mental, physical, or financial health. It's really about how we support each other. And we can do that still with physical distancing and excellent hygiene, but we can all come together as a community and support each other.
Great, great. Thank you, Tina. And then Kent, your closing thoughts? Kent, you're muted, Kent. You might want to, sorry.
Yeah, thanks, Doug.
Yeah.
Oh, you missed my intro.
Yeah, that's right. Turn it.
I want to, this is a perfect example of what we should be doing as community leaders, getting together and coming up with a way to get through the crisis. It's so West Michigan. It's what we all love about our community. I would just say that Tina took the words out of my mouth. This is a crisis we can get through. We can do it successfully. I think it's been proven enough as we're continuing to learn that it can be done safely. I think John and others have talked about how to do that safely. I think as hospitals, we're all doing it now. And I think if others can learn from that, as you're doing this morning, I think that's very helpful. I think maybe I'll end with this. You look at a worst case scenario, Italy just came out with a comprehensive study and plan on how they're going to open up their economy. And there's nothing in there that we haven't talked about already this morning, but they, out of necessity, have to do it. And they are going to do it. And so I think we can look at their plan, as well as Australia's and others who have avoided some of the crisis. We can look at those that have not avoided it, but are opening up their economies and doing it safely.
Great. Well, thank you all. This has been incredibly helpful. I had obviously there's so much data here. I did not do a very good job of moving us through it to open it up for questions. So forgive me for that. We want to honor everyone's time at wrapping here at 11. But just the wealth of information, it's hard to even provide a summary. But I think the many things that were said are important. But one of the things that struck, I think, young Kim, as you mentioned, it's the decisions we take from here, and getting together and learning from each other is huge. And the point of the West Michigan Policy Forum is to help our policy leaders make good decisions as well, and express that we can be trusted as community leaders and citizens to act in the best interests of our neighbors. And to do it very thoughtfully. We want to be part of the solution. Sometimes it feels like decisions get made differently. We want to be very interactive, and at the Policy Forum, we work very hard to offer good options, good solutions, so that our policymakers, can consider them, and we want to do that being informed, especially in something like this, where business leaders traditionally have not had the same level of data that those in our medical community are living with. So it's so helpful, and we want to thank you all for joining us and helping us in that respect. So thanks for joining us, Aaron. I'm going to turn it back to you to close us out, and I wish everybody has a great day.
Thank you, Doug. Thank you, everyone. We appreciate your input. We'll keep you updated if additional information comes out of our work at the West Michigan Policy Forum. This event will be posted on the West Michigan Policy Forum Facebook page if you would like to watch the program. Have a great day.